Welcome to Wellness Wednesday. Wow, what a beautiful September evening we have tonight. I hope that your week has started out well and is going well. I know that a lot of you are joining have joined this group because you're not feeling well. You're tired and you're your hair is falling out. You're not sleeping well. You can't lose weight, and it's it's time for the frog behind me to start making its noises. I know why you're here, and I really want to make sure that we touch on an important topic tonight. But like I said, I wanted to make sure that everything's going well. As we get started in this Wellness Wednesday topic tonight, I do need to say my disclaimer. So everything that, so have to try to remember everything correctly. Please do not take anything I say tonight as health advice. It is health information, and do not start taking or stop taking or change the way you're taking any of your medications. And if you really think you should, please contact your prescriber, your prescribing practitioner to help you do that. It's just really important that you don't make any of these changes on your own. Also, attending this, see, I can't remember everything I need to say for that. By attending this Wellness Wednesday, we don't establish a doctor-patient relationship. And I'm going to leave it there because I can't remember the fourth thing, but that's okay. Tonight, I really thought it was going to be important to talk about diabetes because one of the really important disease states that happens in postmenopausal women with hypothyroidism is diabetes. And actually, as we wait for any more to jump on, I want to make an announcement before I get into the topic of diabetes. I want to talk about and announce for those of you who might be new to the group that I am putting on a master class, a free online master class right here on this page in October 2nd through the 6th. It will be every evening at 8 p.m. Mountain Standard Time, 7 p.m. Pacific Standard Time. And it's free. And we are going to be covering a lot of important information. I'm going to teach you why you're still tired, even if you're taking thyroid hormone replacement or medication, why you're still tired if your labs are still normal, why your hair is falling out, and why you can't lose weight even after all these crazy diets and your labs are normal. We're going to talk about why it's not in your head. You don't need to keep believing that. Why, unfortunately, doctors teach you that what you think about your symptoms doesn't matter, and that is categorically false. It's just vital that you get the right information, and I'm passionate about this because I've had my own thyroid challenges. Family members have their thyroid challenges, and I think we just need to learn the truth. So join me October 2nd through the 6th for that free masterclass. I can't wait to see you there. Okay, let's get into tonight's topic. As I said, the most common disease process that I see happen with postmenopausal women with hypothyroidism mainly because their thyroid disease is not treated appropriately. It's not taken care of properly. It's not even maybe noticed. Maybe it's not even diagnosed, and is type 2 diabetes. Insulin resistance is how it starts, and usually those of you who might also have diabetes or are concerned that you might have it, you go to the doctor and they do a test called the A1C, and if that A1C is higher than 6.5, they diagnose you with diabetes, and type 2 diabetes, which is basically an average of about 140 on your blood glucose. And so, yeah, that's just a number. What's going on with diabetes? What you may not know is this is actually a protective mechanism. And you heard me right. It's one of the body's protective mechanisms to keep you away, keep your cells and tissues away from glucose that cannot be used. It's toxic when it's not used or stored properly. Picture this. Picture inside every cell in your body, you have metabolic motors that are trying to make energy, okay? To help you function, right? And they require fuel. That fuel is glucose. Thyroid starts the motor. I'm not going to cover that tonight. But glucose is the fuel, and it has to be used. And then if it's not being used, it's stored in the liver, in the muscle, in other tissues as glycogen. Glucose as the fuel for these cells. If you want to think about it like this, it's combustible, okay? I mean, not really, but it's like gasoline. That's the best analogy I can make. It's like gasoline, which is also fuel, and if it's burned in the motor properly, great, you're good to go. The motor starts, or the motor can go, and away you go. When gasoline is not stored properly, or when it's not used properly, it's toxic. It's inflammatory, right? Flammable. You're not going to pour gasoline over your engine, are you? No. So, what's the deal with glucose being like gasoline? Well, when it's not being used or stored properly, it makes your cells sick. Those cell membranes react poorly to that excess glucose that cannot get inside the cell because insulin isn't working to get it inside for various reasons. When glucose is sitting around the cells and the tissues, it exerts that toxic influence and can cause your cells to get sick. It can even cause cancer. So, diabetes, what happens is your body wants to get that glucose as far away from the cells and tissues as possible, when it's not used or stored properly, and it puts it back into the bloodstream. Wow, that's why we have a high A1C, because your blood sugar is going higher. It's a protective mechanism. Now, drugs like metformin block that protective process, blocks that from happening, keeps the glucose around the cells, and guess what? There's side effects because of that. That glucose may turn into lactic acid, and so you get lactic acidosis, or lactic acid buildup. You get soreness, you get headachy, brain foggy. There's another thing that happens when this process is interrupted. The cells may actually die, or like I said, become cancerous. And so the problem with not getting the glucose into the cells because insulin won't let it is that these organs and tissues fail faster. When they don't have fuel to burn and make energy, these organs and tissues they're gonna die faster. And so that's why the complications of diabetes can hit you literally from head to toe, because it affects all the tissues, everything. Complications: blindness, kidney dysfunction and failure. Um, you can have bad infections. You can have, uh, you can have so many different types of things. Immune dysfunction, Alzheimer's. This affects your adrenal glands. This affects the way you produce energy for your whole body function. Gut issues, gastroparesis, or where your stomach doesn't move properly or your intestines don't move along properly. Neuropathy. All these complications that can result in really hideous things, not to mention heart attacks and heart failure, but amputations and, just like I said, infections that don't quit. This reminds me of a story of, one of the patients that I helped to take care of in my in medical school. I was helping the surgeon, and I was interviewing this gentleman who was there for an amputation. It was his third amputation surgery. He had had 2 toes amputated a few months prior. Then his foot had to be amputated a couple months later. And now he was facing a below-the-knee amputation because he had an infection that started in a couple toes that would not go away with antibiotic treatment. The diabetes had affected his immune system so terribly that it wasn't helping him fight this infection off. And it just kept spreading and spreading. He was he wasn't that old. He was like in his early 60s. He was taking his medications and doing everything right, that he knew to be right. He was eating properly. He was, exercising, and he really felt pretty good, he said, when I was interviewing him. And so here he was in for his amputation surgery, and I don't want to be too graphic, but I was helping the surgeon with the surgery, and he's putting the staples in over the stump, and I asked him, how often does this happen? Why does this happen with diabetics so much? And he said, oh, these diabetics, they don't do what they're asked. They don't take their medications. They don't eat right. They don't do what we tell them to do, and so they get these infections. And I was really dumbfounded, because in talking with the gentleman before the surgery, doing his history and physical, I learned that he was trying to do everything he knew how to do. So this is kind of an aside, and I know I'm going off on a little tangent here, but that was something that I learned from this surgeon, that he doesn't trust the patients, and that's never left me. It's really been kind of, I don't know, just really shocking to me that we wouldn't listen to our patients as doctors, because who knows the best about their body but you, right? You know the best. You know what your body's feeling. You know that you're in pain. You know that you're tired. So anyway, back to, unfortunately for this gentleman, his diabetes may have been, controlled with medication, but he wasn't fine. He wasn't healthy, and he ended up passing away not even a year later, I came to learn, after that amputation surgery. Diabetes affects every organ. And it's a problem with every organ. It's a problem with these organs talking together. It's a problem because, let's start with the liver, for example. The liver is really the home base, right, for glucose metabolism. Everything we eat goes through the gut and then to the liver, and that's where insulin resistance starts. And this is why we have to be so careful, because the liver does so many things for us. I jokingly say it does about 500 different things, and that's probably not far off. It's where it starts. And so the liver helps you convert thyroid hormone, it makes cholesterol, it converts cholesterol to different particles that you need. It detoxes you. There's 3 different phases of detox within the liver to help get impurities and toxins out of your body. It helps you with fat digestion because of the bile it produces. It helps with hormone conversion. Yeah, ladies, especially after menopause, guess what? Your liver participates in helping to convert DHEA to estrogen and testosterone when you don't have your ovaries functioning anymore. The liver does so many things, but when it becomes resistant to insulin, it starts to become dysfunctional, and that starts a cascade of things happening. When the liver becomes resistant to insulin, other tissues then become resistant, and this means that insulin isn't working to get glucose into those cells as fuel, and then they stop working together as much because they're not functioning as much. The pancreas, it makes your insulin. It makes glucagon, another hormone involved in glucose regulation. See, guys, if your body doesn't regulate glucose properly, you die. It's like one of your body's basic functions to regulate glucose. When your pancreas knows that blood sugar is high, it starts to make more insulin. And the more insulin you make, the more resistant to it you become. That's really important. Insulin itself can become inflammatory and cause even more insulin resistance. So you might ask, well, why do they treat diabetics with more insulin? That's a darn good question. And so by the time you've run out of options with other medications, and I've mentioned just one, metformin, there are so many others, glipizide, gliburide, glimepiride, Januvia, Ozempic, Victoza, Jardiance, Trulicity. I mean, the list is a mile long, and there are consequences to you taking these medications when you have diabetes, because they override your body's ability and co-opt your body's resources to make them work and to bandage the symptom of high blood sugar. Symptom of high blood sugar. Please, make sure you heard that right. That is a symptom of what's going on deeper, so that's not the problem. And it really has to be really high in your blood for a long time to be super inflammatory. That's true. But it is, like I said, it's toxic when it's not being used or stored properly. So when it's in the blood and attached to hemoglobin, that helps to buffer it a little bit, and it can be a long while before it really exerts a toxic influence on your blood vessels, but it sure does. Okay, when it's high enough, it sure does. So back to medications, you have side effects from these drugs, and so doctors will give you more drugs to combat the side effects, and it's just a vicious cycle of one drug after another, and I'm sorry, ladies, but this is deadly. This disease shaves 10 years off your life on average. You've got to stop it. You got to stop this freight train from continuing down this track at a very high speed sometimes. Now, for some of you, it's going pretty slow, and that's great, but it can rob you of the quality of life, as many of you know who have been diagnosed. Well, maybe you don't know. Maybe your doctor hasn't had the time to explain these complications, to explain what happens with all these organs that suffer from a lack of glucose and insulin resistance. So what other organs are involved? The adrenal glands, very much involved in glucose regulation. They produce cortisol, the stress hormone, which helps blood sugar rise when you need it. When you're hypoglycemic, your body will produce cortisol because that's stressful. And then your body will secrete more glucose, release more glucose, and of course then insulin goes up, and it often gets, the glucose goes higher often too early because the regulation mechanisms are off. It's a whole thing. And so the adrenal glands in this way participate in glucose regulation. So it's interesting, just a little aside on hormones and what happens when you have insulin resistance or diabetes. So for women, instead of producing enough estrogen, a lot of times because of insulin resistance, your body will produce more androgens, so testosterone and those similar hormones. And so some of you from a very young age dealt with something like polycystic ovarian syndrome, which is a very early onset of insulin resistance. It doesn't mean you have diabetes, but it starts the insulin resistance process. And my goodness, you have infertility problems. You have problems with irregular periods, or you don't have them at all, or you start growing a lot of hair in places that you don't like. In men, it's the opposite. Testosterone gets converted to estrogens when they're insulin resistant, and so your poor husbands who have diabetes have weakness. They're losing muscle tone. They're impotent. Their breasts are enlarged. They're weaker. They're feeling poorly because they don't have enough testosterone. And even their doctors who give them testosterone are doing them a disservice because that testosterone is still going to be converted to more estrogen. This leads to prostate enlargement and breast cancers in men. It's crazy, you guys. Let me go back to, sorry for that little aside on hormones, but we're going to go back to the organs that are helping to regulate glucose. The gut, okay? So you eat and you turn that food into glucose, whether it's amino acids, whether it's fatty acids, or carbs. Well, that's the simplest solution to get glucose. Guess what, ladies? You don't need carbohydrates. They're not essential. They help us feel better. They give us energy. But when you're diabetic, you don't need more carbs, okay? You need to regulate. And in order to help you regulate things, you got to cut them out. So it starts in the gut is really important in glucose regulation because that's where glucose gets absorbed. That's where it goes to the liver. That's where, the fats and the proteins get processed. And absorb, the building blocks get absorbed into your intestine, and so that helps with regulation. But you also can have infections, bacterial overgrowth, yeast, parasites, that all impact how glucose is regulated. So there are several things going on in your intestines that, can cause diabetes, can cause autoimmunity, and many other things. So, all right, let's talk about the brain. It's the master organ, right? It's got everything under control. It knows everything, at least subconsciously it does. And one thing it does to regulate blood glucose is to signal, some of your cells not to produce as much. Not to allow glucose into the cells, so your cells aren't making the insulin receptors because they can't use it. Your brain knows this. Your brain also contributes to the regulation, I shouldn't say the problem, by not allowing thyroid to work as well. Wow, isn't that interesting? When the brain doesn't allow, it doesn't make enough TSH to stimulate your thyroid because it can't afford for you to release any more glucose into from the fat, because thyroid will cause glucose release, fat release and basically fuel release from fat. This is a real problem in a way, because this is when things really go off. So your brain also is affected by low glucose. It's when it can't get glucose into the neurons. This is when you start getting white matter disease or white matter shrinking, also known as Alzheimer's. Diabetes type 3, you may have heard that term, is what they now sometimes call Alzheimer's disease. Because your brain really needs a lot of glucose. And when it doesn't get it, it can't function. And when it can't function, it shrinks. All right, let's talk about the immune system. Diabetes, so infections affect the immune system. Infections raise blood glucose. One of the most important things that happens in the blood is your blood will take on more sugar as a last-ditch effort to stop the infection from taking over. Glucose is toxic to a lot of the things that cause infection. And so if there's something in the blood that's going to be, widespread, you better believe that, your glucose is going to rise to counteract it. And so this is a really interesting mechanism. The immune system is affected by diabetes as well, because, your white blood cells get turned off because they're not getting the glucose that they need. They're insulin resistant as well. And gosh, it all works together. All these organs and systems work together. If they do work properly, they regulate your glucose correctly. But when they don't, when they start suffering from insulin resistance, it's kind of a downward spiral unless you can interrupt it and help these organs function better. Help your gut by eating the right foods, having the right lifestyle, and other certain supplements that are certainly very individualized and need to be very individualized. Can this process be reversed? It can be reversed. That's what I think the biggest message that I need to leave with you this evening is, that diabetes can be reversed. I can't count how many times I've seen it happen. One of the most impressive turnarounds I have seen was a gentleman. Actually, I've had several, but let me talk about one gentleman who, up in northern Idaho, he's a real hard worker. He worked as a drywall finisher, and he was up on stilts all the time. But the problem is, he was suffering from neuropathy, and it was getting tougher and tougher. He was getting more tired, and his work was really, his self-employment was really suffering, because he just couldn't do as many jobs and couldn't do as many big jobs. He had to lose about 60 pounds, and he got after it, and his neuropathy went away. He lost the weight. His impotence improved. He let me know several times that his wife was really happy with him. He got to the point where he was able to do double the work that he was doing before. He had all that. He developed that much more energy, and he didn't have the brain fog that he complained about as well. It was just an amazing turnaround. Another lady who, within 5 months, was able to bring her A1C down from, I want to say it was about 8.5 on medications to 5.5, 5.5 off medications, and energy went way up, headaches stopped, lost about 40, 45 pounds as well. Just felt amazing, felt like she had a new lease on life. Had to help correct her thyroid as well. Had to, help her with a lot of other imbalances that we found in her testing. But that's what we need to do. And so I guess I'll leave it there. I just felt like diabetes was a really important mechanism to discuss because, unfortunately, there are many of you who deal with it as well as low thyroid. Bottom line is, you can find answers. Watch the masterclass. If you haven't registered for it, please do so. The link will be posted in the comment section. Again, it happens October 2nd through the 6th, and we're going to address all those things that you really need to know to fix your thyroid issues. And who knows, maybe those of you who have diabetes will also learn what you need to do to reverse that, because honestly, it takes getting to the root cause, and we have to figure out how to find that. All right, ladies, it's been a pleasure. I hope you have a wonderful evening. It's getting dark out here, but it's beautiful. Enjoy the rest of your Wednesday night and have a great week. And I will see you in October for the masterclass. And remember, you still have the power to heal. Good night.